Hello, last video I was talking something about cardiorespiratory exercise. I told that they are linked unless these two organs, the lungs and the heart, are in good condition. Training one organ is not sufficient. And again, I told both are involuntary organs, not under our control, but to some extent you can control the breathing pattern. It's not actually control. You are training yourself to try a different pattern of breathing, increasing your inspiration, breathing in and holding the breath for some time, and again sending the whole air which you have breathed in out. You try and do this, and you train to do this. If you train your respiratory system, namely the lungs, and if the heart is not able to pump properly, then there's no use in training your lungs alone. We are not increasing the capacity of the lungs, but we are utilizing the capacity of the lungs. How we use this capacity? For that, you should know what is the capacity of the lung, the respiratory capacity and the cardiac capacity. How to train your lung and how to train your heart to do more work with less effort. Your lungs, your respiratory muscles, your heart, which is also a muscle, should not suffer. At the same time, you should achieve the target. And what is the actual capacity of the lung? Do I really need these exercises? Should I do this? Well, we face situations, different types of situations on different occasions. Some are planned. We expect what we are going to do. Some are unplanned, unexpected. Exercise, athletes, gym, fitness, walking, all this you plan, and if you are not able to do it, you can stop it very well. Facing a threat, a swimmer, accidentally, there may arise a situation where you are dragged in. You feel like drowning at that time. Now, you never expected it. A person who had a cardiorespiratory training, the way they face the situation will differ. You can run away from an animal, but you cannot run away from problems. You cannot run away from stress. These are all a part of your life. But to some extent, these cardiorespiratory exercises, they not only control physically, the physical response to these situations, it helps in managing a stressful situation. If you are trained, I can even say in a different way. When you face an emergency, there are two things. Either you react or you respond. Reaction is a reflex. You don't think much. Suddenly you take decisions. Emotionally you take decisions. An emotional decision, most of the time, may not be 100% perfect and 100% correct. So if you have the power to control your emotions, your decisions will be better. So in a way, this cardiorespiratory exercises makes you respond to a situation rather than to react to a situation. When you do an exercise, when you run, why do you stop? Your respiration becomes very fast, rapid. Your heartbeat increases. Because of this increase in heartbeat, you have palpitation. And because of increased rate or rapid respiration, a fast respiration, you feel breathlessness. So if I have a control on this rate, I can do a better performance. You have to take more air in without increasing the respiratory rate. The heart has to pump more blood without increasing its rate. This is the actual training process. I told about the rate. So what is a normal respiratory rate? The normal respiratory rate is a range actually from 12 to 16 or 20 even. At rest, when you are not doing any work, when you are not doing an exercise, when you are emotionally stable, we'll take it 12 for calculation. purpose. And when you do an exercise, when you are very angry, when you are anxious, it may even go to up to 24, 30, something like that. I have to increase the volume of air, which is at the same time, the rate should not increase. My rate is 12 right now, and the demand is doubled. Then naturally, I have to increase the rate to 24. But training, I said 12. 12 cycles per minute. What is one cycle? You take air in, you call it inspiration or inhalation, and you are breathing out. This is called expiration, exhalation. One inspiration plus expiration, if it is one cycle, then you are doing 12 cycles in 1 minute. 1 minute means 60 seconds. Then what is the time taken for one cycle? 60 seconds, 12, and one cycle means only 5 seconds. In this 5 seconds, 2 seconds you take the air in, and 3 seconds you breathe out. Taking air is an active process against the resistance, and once you stop breathing in, naturally the air which went in comes out like a balloon. For an untrained person to get this extra air, to double the volume of air, will have an increase. A trained person will keep same 12, but he will double the volume of air. Well, I told the respiratory rate is 12. Let us do some maths. So 12 times you take in and out. How much air you take when you breathe in normally at rest? It is just 500 ml, half a liter of air only you are taking in and you are breathing out. So when you do 12 times in a minute, it is equal to 6 liters of air, 6000 ml. This is what you are doing normally at rest. This volume of air, you call it tidal volume, and this type of respiration, where taking just 500 ml in and out, you call it tidal respiration. Now imagine a situation, a person is doing an exercise. Now his demand increases to 2 times. That means he needs, instead of 6 liters, now he needs 12 liters, 12,000 ml. An untrained person will achieve this target, will get this much of air by increasing the respiratory rate from 12 to 24. The volume doubles, the rate also doubles. For 6 liters, 12 times, for 12 liters, 24 times. This is an untrained person. When he does this, the 24 times makes him breathlessness. Just think the other way. A trained person, what he does, instead of breathing just 500 ml in and out, now he increases his to double, that is 1000 ml. This 12 cycle, I will breathe 12,000 ml. What does that mean? Without increasing the rate from 12 to 24, he just increased or he doubled the quantity of air which is he is breathing in. He also achieves this 12 liter, but his rate remains only 12. This is the actual basis of doing a respiratory exercise. Now the question is it possible to take 1000 ml during one inspiration? If you want to take more air after this 500 ml, that is the tidal volume, you can breathe in around 3300 ml after this 500 ml. Now how much of air you have breathed in now? It is around 3800 ml. This 3300 ml, you call it the lungs inspiratory reserve. It is your inspiratory capacity. You are capable of taking 3300 ml plus 500 ml. That means what? 6 times more you can breathe in. Next thing is you are taking 500 ml in and you are breathing out 500 ml. Now you try to send more air out by your training. What is that? You constrict your chest cavity and you constrict your abdominal muscles. Now you use all your muscles to send more air out. How much more air you can send out after this 500 ml is another 1000 ml of air after this 500 normal expiratory volume. This expiratory volume, 1000 ml, you call it expiratory reserve volume. So, or this is your lungs expiratory capacity. So now for a calculation, you are taking 500 ml first in, and then after 3300 ml inspiratory capacity or reserve volume, plus this 1000 ml expiratory capacity. So totally, when you use this tidal volume, this inspiratory capacity, all these things, when your lung is full, how much of air you will breathe out? You will breathe out around 4.8 liters, 4800 ml. So this is your total lungs capacity. So this quantity of air you want to take in and out. You are training yourself to use this capacity. So this is the type of training you are doing. When I have sent out all this 4800 ml, does it mean the lung is completely empty? No. Even if you expire all the air, after that also you will have some volume of air inside. That is called residual volume. That is around 1200 ml. So what does that mean? Just because we are not trained, we are just using this 500 ml in and out. Sedentary workers. We are not using the lungs capacity. That is because you don't get a situation normally in a day-to-day life. But when a situation arises, because you are not trained, you are not able to use this lungs capacity to face that situation. Imagine in one cycle, if you are able to do 4500 ml multiplied by 12, it will go to a very huge volume. But what we are doing is just 500 ml 12 times 6 liters only. We train you to use this capacity only. In fact, this is the basis of doing pranayama. What they do, ask you to inhale fully, hold the breath for some time, and exhale. Why do you want to hold the breath inside for some time? Very simple. When you take this much of 4500 ml of air during inspiration, you will have a lot of oxygen in that air, and you give time for the blood to extract all this oxygen. So excess oxygen means excess blood should take this excess oxygen. That needs a time. That is why you hold your breath. And even in pranayama, the final step many people do is a forceful expiration like that. You know what they do? Why they do? Even after full expiration, even after this 4500 or 800 ml out, I said the residual volume 1200, even that volume they want to get out from their lungs. The purpose is, even in that 1200 ml, there may be some carbon dioxide. They want to get rid of that. That is why they do as a last step in pranayama. So respiratory exercise is just equal to pranayama. In fact, you are training your lungs during an emergency, during a stress, during a threat, because you are trained, you will not get a fast or rapid breathing. This type of exercise is not just an endurance exercise, it's a sort of strengthening exercise also, because you are training your respiratory muscles. These muscles get strengthened. The strong muscles, when they contract, the expulsion of air and the intake of air is done easily because the muscles are strong. Now, if you train like this, and if you know these numbers, if you know your capacity, when you do an exercise, all these days you don't know what you are doing, whether you are doing it properly, and what is the purpose of this, and how much I train my lung. All these are only just a vague idea. Now I have given the exact numbers. Now you know the real capacity. When you do an exercise, there will be something running in your mind. I am taking this much of air, 3000 ml. I am expelling this much of air, 4500 ml, like that, Then this exercise itself will become a pleasure for you. Shall we meet in another video. How the heart cooperates. What are the changes that takes place in the heart? How you prevent this palpitation? How you train your heart to increase its pumping capacity without increasing the heart rate? What happens? Is it possible? Because it is not under our control. All these things we will see in the next video. I am Dr. Balasubramanian. Thank you.